Mrs. S, a 64-year-old woman, born and raised in the British countryside, lived there her whole life. Worked in the local primary school for the last 30 years as a teacher, and married for the last 40. Recently divorced around a year ago. Had her first child at the age of 24 and a second at the age of 34. Recently divorced in the last year. Her two daughters live out in different cities. They don't visit her much, but call her on a daily basis, or whenever they can. She lives alone now. She still works, but recently, in the last few weeks, she's been finding it tough to go to work, often showing up late, and sometimes not going at all. Some mornings she struggles to even get out of bed in the morning itself, staying awake or staying asleep until it's late to the end of the day. Work has been understanding of her situation, and they've been trying to help her, and they understand that she may not be able to show up or attend at the right times, so they've been more relaxed with her. But she's still afraid that one day they will fire her, as she's not doing what the work requires of her. On top of that, she is taking care of herself on a day-to-day basis for the essentials, such as cleaning or eating. But she's still neglecting her body and her mind. Not getting up, not getting the right food, not cooking for herself, choosing takeaways that are unhealthy. And she finds it no motivation or no enjoyment in her day-to-day life. Fast forward 6 months. She's now stopped turning up to work, even though she's still hired, and now she's at risk of losing her job. She's now being encouraged by her friends to see the GP, for which she attends. The GP is also concerned for her health and refers her to psychiatric teams. The GP also sees that she has a breast screening clinic coming up in the next 3 weeks. Again, she had to be convinced to attend the clinic, and she found it to have no motivation to attend it at all, and she was in fact anxious and worried about it. In the meantime, she starts going to see the psychiatric team. She's initially diagnosed with depression, and from there sees a therapist once a week. She likes the company, but she also finds it hard to get out to see the therapist. Fast forward to 3 weeks, she's at the clinic, the breast clinic, and the regular breast examination is performed on her. A visual inspection, followed by a hand examination, followed by a mammogram. Throughout this, she was stressed. At the start, she was anxious, not just because of what might happen to her and the fear of a breast cancer, but also her body image. She was anxious to strip down from the waist up, and she was embarrassed by it. She enjoyed the presence of a chaperone, someone who could comfort her in this process. But even then, she was anxious throughout. And more so when the doctors told her that they have to see her again in 2 weeks' time because of some concerns that they've seen on the mammogram. This was coupled with the fact that during the screening they took a history of her. The doctors recognized there were 2 major risk factors for breast cancer. The fact that she had late menarche at the age of 14, and the fact that she had a high BMI of 36. In between the first screening appointment and the second screening clinic appointment, she was regularly attending her psychiatric team meetings. She enjoyed the therapist. She lived alone. She was alone. She found company in someone that she can regularly see, and someone who would listen to her. She requested that she sees them more often, more than once a week, to which that can be arranged. In the meantime, she was still taking her antidepressants, and she was exploring other CBTs or cognitive behavior therapies to help her with her depression. She had to be motivated throughout this journey to help her with her depression. The therapist the doctors, they convinced her for the treatment and for the CBT. And the therapist also convinced her to come and attend the sessions. Even though she enjoyed it, she lacked the motivation, as pronounced earlier, to show up. The day comes, the second visit to the breast clinic. The doctor explains to her how they found suspicious changes in her mammogram, specifically of what seems to be calcifications in her breast. Although no lumps were felt in the breast examination, and nothing peculiar was seen in the visual inspection, sometimes cancers can be hidden. And in her case it was. No symptoms, no physical signs. Only imaging can tell the truth. And even then, they weren't sure. So they had to get a biopsy. But the fear of a diagnosis kicked in, coupled with her depression. She just did not feel motivated to live anymore. In the breast clinic, they requested a biopsy to confirm of her cancer. They were suspecting it was DCIS, or ductal carcinoma in situ. Ductal carcinoma because it affects the ducts of the breast in situ, because it has not migrated beyond the ducts. And in her case, it seemed to be affecting only one duct on one breast. They explained to her it was precancerous, and that it was treatable with surgery and chemotherapy afterwards. But again, the fear of cancer kicked in, and she refused treatment. She was too scared and too unmotivated to suffer, or she was afraid of the suffering that she would have to go through. This was something that she explained to her therapist in the next visit after her screening clinic, as after this visit to the therapist, she did not show up as often as before, skipping 3 appointments. When she was at her first appointment with a therapist after the breast screening clinic, she explained how she was just not motivated to live anymore. Specifically, she did not want to live to see that day of her diagnosis come true, and she'd rather just not live there at all, or go through it at all. She wasn't having any suicidal ideations, just a lack of motivation to live. Her depression was worsening, the cancer only adding fuel to the fire. 3 weeks later of living alone, scared and unwilling to get the treatment she needed, she got a surprise visit from her older daughter. A surprise it was indeed, and it was a wonderful surprise. This was the first time she'd seen her family in almost a year. After a bit of talking, she broke down into tears to her daughter. She was reluctant at first to explain what was happening, but it was her daughter nonetheless. And again, a recurrent theme in this is that she was convinced to tell her daughter the story. Her daughter struggled again to convince her to get treatment, hopeless at the fact that there was no one with her to hold her hand as she went through this journey. This slightly changed when her daughter started showing pictures of her grandchildren, Mrs. S's grandchildren, to her. A smile, first time in a while that Mrs. S has smiled at the laughter of her grandchildren. She enjoyed the pictures. What she did not expect, and it was a wonderful shock yet again, was that her daughter was moving back to the town that she lived in with her mother. She found work there. She was bringing the family. The daughter stayed overnight with her mother. Looking through the pictures, Mrs. S realized that she did not want to die without being there for her grandchildren, seeing them grow up. Although still needing a kick and for motivation to be treated, Mrs. S accepted that she'll go back to talk about the treatment with the doctors. She explained this to her daughter and why she felt motivated after seeing her grandchildren. Finally, we start turning over a new leaf for Mrs. S and her medical journey. And how medicine is wonderful, not only in how we treat patients in the hospital, but the stories that patients go through. And this story brought up 3 aspects of medicine that we need to talk about. Mainly breast cancer, depression, and the ethics of medicine. Mrs. S had DCIS, ductal carcinoma in situ. This is a precancerous lesion. It's considered that because it doesn't really migrate beyond the duct. Sometimes it can, sometimes it can't, and it's not often malignant, often affecting only one duct of one breast. However, even though they may not present in any physical signs or symptoms, they can still affect the breast, blocking the ducts. And there are still 2 kinds. There's comido and there's non-comido. Non-comido being the more aggressive one, the more malignant one, the one that is more invasive of local breast tissue, growing faster, growing so fast that it can't even supply itself with the right amount of nutrients to live, with the center of the cancer inside the duct undergoing necrosis. Mrs. S has had non-comido DCIS. Now that's different because it grows much slower, sometimes not even fully blocking the duct, and there's no central necrosis. So really here she had the option of surgery, either lumpectomy, which is what the doctors would have likely gone for her to preserve her breast, or mastectomy, which is something that would have been performed if more of the breast has been affected. But then there's also the aspect of depression, brought upon by loneliness and by divorce. The fact that she had no one to talk to, and she was growing old without anyone. She developed a lot of substantial life changes in such a short amount of time, and she had no one there for her while it was happening. She was struggling to self-care, work and socialize with other people. Cancer only added to this fuel. Depression added to her cancer, and cancer added to her depression. It was a spiral, often seen in medicine, where patients undergo a spiral of decline, either physiologically or psychologically, or both. Mrs. S refused treatment that was life-saving, but the doctors could do nothing about it because she still had autonomy, the ability of someone to make their own decisions for themselves in a medical setting. The fact that she was able to ingest the information, understand it, retain it, repeat it, and make a decision upon the information that she was given. And there's also the aspect of confidentiality. Doctors could not tell her daughters about what happened, nor her ex-husband, nor her co-workers, nor anyone that she was close with. She was the only one that had the choice, especially because she had autonomy. But again, if it wasn't for her telling her daughters the truth, maybe Mrs. S would have never turned over a new leaf, and her life would have never continued. So that is medical ethics. A dilemma that we all have to face, on top of treating the medical condition. Thank you so much for watching today's episode of Medicinals. It was one that I enjoyed writing, talking about someone's causes of causes, about how the medical journey doesn't just start at the hospital or at the doctor, but at the moment of conception, the moment of birth, and ends at the moment of death. There is so much more to medicine that we do not see on a day-to-day basis, but patients live through, and that's called life. Thank you so much. Please do subscribe, like, and leave a comment. It'll be very helpful for me so I can bring on more good content to you. Thank you so much.